sins of the world were heard in the hearts of a few, and with the love of God powering their passion, healing began.
If there were more programs like CMF, the world would be a much better place.
Christian Medical Fellowship began in 1994 in Hartford, Connecticut. Burdened by the unique pressures of working in medicine, local healthcare professionals gathered to support one another emotionally and spiritually. They wanted to serve God with their medical skills and found opportunities to do so in their own backyard. They organized health fairs in Hartford's depressed neighborhoods, offering care free of charge. During the holidays, CMF visited patients at hospitals and nursing homes. They carried with them a message of peace and of joy. And as they did, a common vision grew.
There was just a realization of a global need to take this ministry into other parts of the world and bring care to needy people.
Their first opportunity came in 1997 in Nigeria, a nation of more than 150 million people, a land where more than 250 different languages are spoken. 20% of the nation's children die before their 5th birthday. Most Nigerians have never seen a doctor.
As in 1957, I've seen Dr. Deto. I have BP. I have pains here.
My heart is hot. My heart is hot.
Volunteer doctors, nurses, dentists, and medical students set up operating tables. Each day, hundreds, often thousands of Nigerians waited patiently to receive long-awaited medical care. They traveled on foot from villages as far as 100 miles away. They suffered from blindness, bleeding, malaria, and malnutrition.
They're coming here saying, I want you to help my child, I want you to help my husband, I want you to help my mother or myself, I want to get better, and you are my hope.
Inspired by the grave needs and grateful eyes of the people, CMF returns to Nigeria every year.
In the years we've been doing this, we've seen over 40,000 patients, but each single person has their own story.
This face in particular has left an indelible impression. As a young child, Farouk Adams discovered an unusual growth on his leg. As it grew, the bone sliced through his skin, and the resulting wound became grossly infected. Unable to afford Farouk's medical care, his mother abandoned him. For years, he walked alone in agony. He slept on street corners. He begged for food. The stench of Farouk's wound turned him into a burden that no one would bear.
Farouk was sitting on the side of one of the pathways with a kind of a blanket around his legs, because if he took the blanket off, the flies were kind of swarming around the infection.
We could see the dead bone sticking right out of his leg, and really nobody really wanted to get close to him at that point.
But when CMF came face to face with Farouk's bright, pleading eyes, he immediately found a home in their hearts. Wanting to show him a love he had never known, CMF decided to financially support Farouk full-time. After 2 operations, his leg was saved, and he can walk without pain once again. Today, Farouk goes to school and says he's grateful to CMF for giving him something he never thought he would have, a future.
If I grow, the thing I plan, I'll be a doctor. So that me too, I can help other people that not have me.
The Nigerian government realizes the importance of CMF's work among their people. In 2004, land in the remote village of Plateau State was donated to Christian Medical Fellowship. Here, CMF plans to build a hospital as well as an orphanage so that soon Farouk and children like him will have hope for a better life and a place to call home.
We brought life to people, we brought smiles on people's faces. Lives are being transformed. People are giving their life to Christ because of what CMF is doing. God is using CMF in this part of the world.
CMF seeks to do more. In 2003, they forged a relationship with Siberia, where tuberculosis and alcoholism are rampant, where one abortion is performed for every live birth, and where many doctors work in other fields so they can make a decent living. Ill-equipped healthcare professionals in Siberia are mired in political restrictions and desperate for assistance. CMF is one of only a few medical organizations allowed to enter the region and provide health care.
The world is not just waiting for help in general. They're waiting to really be trained and equipped so that they can help their own people.
The hospital in the capital region had received an ultrasound, but nobody knew how to use it. We were able to show them how to do pregnancy ultrasound and how to measure the size of the baby and how to do some of the techniques that they had never learned how to do.
What was most significant about that trip was, as they were leaving, the government came to us and said, what you've done here was you built a bridge that we want to continue.
Similar efforts are underway in Sierra Leone and Haiti, where land in Masad has been donated for an orphanage. As the global vision has grown, dedication to the local community has never wavered. CMF continues to sponsor health fairs, neighborhood outreaches, and guest speakers. In partnership with local churches, they provide counseling and alternatives to abortion at crisis pregnancy centers.
I think one of the more difficult places to do ministry is locally. And there are so many reasons that in our sense of busyness that we can just overlook those needs or say someone's going to meet those needs, when in fact no one is.
With continued growth comes the need for more mission-minded healthcare providers. And CMF wants to shape the doctors of tomorrow by developing a faith-based residency program through which doctors would receive hands-on training at international CMF sites as well as local faith-based clinics. By training doctors in this way, permanent and ongoing care for the underserved can be guaranteed.
CMF is one of many programs where people are phenomenally dedicated to giving back all the things that they've gained.
Caring for colleagues, caring for communities, caring for a world in need, marked by a healing message of peace and of love that knows no borders.
I think anybody should become involved with CMF because it's a way that you're able to use the gifts that God has given you, whether you're medical or you're not medical.
It doesn't matter who you are or what your talents are or what your skills are or your degree, but that God can use you in Christian Medical Fellowship.
I would recommend Christian Medical Fellowship to anyone that has any desire at all to help one single person or thousands of people. It'll change your life. You'll be happy you did it.